Preeclampsia is a serious pregnancy complication that can be life-threatening for both the mother and the baby. It often develops after the 20th week of pregnancy and, if left untreated, can lead to severe complications, including organ damage, seizures, or even preterm birth. The problem is that many women might not recognize the early warning signs, and that delay can make all the difference. Understanding the key symptoms of preeclampsia is crucial for early detection and proper medical care. Here are the most critical signs you should never ignore. The first major symptom of preeclampsia is high blood pressure. While it is normal for blood pressure to fluctuate during pregnancy, a consistently high reading of 140/90 or higher may indicate preeclampsia. High blood pressure restricts blood flow to the placenta and can lead to complications for both the mother and the baby. If you notice sudden spikes in blood pressure, it is essential to seek medical attention immediately. Another common symptom is severe swelling, also known as edema. While mild swelling in the feet and ankles is common during pregnancy, preeclampsia-related swelling is more severe and sudden. If you notice excessive swelling in your face, hands, or around your eyes, it could be a warning sign. This swelling occurs because preeclampsia can cause the body to retain excess fluid, leading to significant discomfort and increased blood pressure. Headaches that don't go away with usual pain relievers or rest are another red flag. These headaches are often severe, persistent, and may feel like intense pressure in the head. This occurs due to changes in blood circulation and increased pressure on the brain. If you experience a headache that won't subside, it is crucial to speak with your doctor. Changes in vision are another alarming symptom. Many women with preeclampsia report experiencing blurred vision, seeing flashing lights, sensitivity to light, or even temporary vision loss. This happens because high blood pressure can affect the blood vessels in the eyes. If you notice any sudden changes in your eyesight, it could be an indication of worsening preeclampsia and should not be ignored. Another key symptom is upper abdominal pain, particularly on the right side, just below the ribs. This pain can sometimes be mistaken for indigestion or normal pregnancy discomfort, but in the case of preeclampsia, it is often a sign of liver problems. This discomfort is caused by increased liver enzyme levels, which indicate stress on the liver due to high blood pressure. If you have persistent pain in this area, it's important to get checked. Nausea and vomiting are also potential warning signs, especially if they occur later in pregnancy. While morning sickness is common in the early stages of pregnancy, new or worsening nausea and vomiting in the second or third trimester can be a sign of preeclampsia. This happens due to the liver and digestive system being affected by increased blood pressure. If you are feeling unwell beyond the typical morning sickness period, take it seriously and contact your healthcare provider. Shortness of breath or difficulty breathing can be another dangerous symptom. Preeclampsia can lead to fluid buildup in the lungs, making it harder to breathe properly. If you find yourself struggling to take deep breaths, feeling unusually out of breath, or experiencing chest tightness, you need medical evaluation immediately. Decreased urine output is another concerning sign. Preeclampsia can affect kidney function, leading to reduced urination. If you notice that you are urinating significantly less than usual, despite drinking enough fluids, this could indicate kidney stress due to high blood pressure. A simple urine test can check for excess protein, which is a key marker of preeclampsia. Speaking of protein, one of the hallmark signs of preeclampsia is protein in the urine, known as proteinuria. This occurs because the kidneys are under strain and start leaking protein into the urine. Since this is not something that can be seen or felt, doctors usually check for it during prenatal visits. If preeclampsia is suspected, further tests will be done to assess kidney function. One of the most serious complications of preeclampsia is eclampsia, which involves seizures. While seizures do not always occur in cases of preeclampsia, they are a clear sign that the condition has progressed to a life-threatening level. This is why early detection and monitoring are critical. There are certain risk factors that make some women more prone to developing preeclampsia. If you have a history of high blood pressure, kidney disease, or diabetes, your chances of developing preeclampsia are higher. Women carrying twins or multiples, those with autoimmune conditions, and first-time mothers also have an increased risk. If you fall into one of these categories, regular prenatal checkups are even more essential. Preventing preeclampsia is not always possible, but there are steps you can take to lower the risk. Staying active, maintaining a healthy diet rich in leafy greens, whole grains and lean proteins, and keeping stress levels under control can all help. Drinking plenty of water and monitoring your blood pressure at home can also make a difference. Your doctor may recommend low-dose aspirin or specific supplements if you are at higher risk. The most important thing to remember is that preeclampsia can escalate quickly. What starts as mild symptoms can rapidly turn into a medical emergency, which is why early detection is crucial. If you experience any of the symptoms mentioned, do not ignore them or wait for them to go away on their own. Trust your instincts and seek medical advice right away. Understanding the symptoms of preeclampsia can save lives. Whether you are currently pregnant, planning to become pregnant, or know someone who is, spreading awareness about this condition is essential. Knowledge is power, and by recognizing. Please make sure to subscribe and comment to help us create more content. Thank you. See you in the next video.